Get Healthy Cincinnati from the Christ Hospital and these local partners.
I'm Warren Harding. I'm an orthopedic surgeon and I practice at the Christ Hospital. Patients should consider seeing a doctor to take care of injuries when certain red flags come up. Those red flags would first of all be pain that is unmanageable. Beyond that, if there's any kind of progressive loss of strength, sensation, or motion, and lastly, if the problem persists longer than you think you should have to put up with it. Non-surgical approaches to injury are basically standalones, but they're also used in the rehabilitation of injured shoulders that require surgery. And you can separate them into four distinct parts. The first, again, I guess should be the fifth part, and that is make the proper diagnosis. That's always the important thing. And then if you can get rid of the inflammation somehow, you give the patient a chance to get better much quicker. So that involves perhaps modifying activity, whether it's improving a pitcher's form or teaching a bricklayer or a painter how to paint more efficiently. So the first one is identify the problem. The second is to take away the offending mechanism of injury so it doesn't keep happening and keep you going 2 steps forward and 2 steps backward. Next, using anti-inflammatory medicine per se is actually very helpful. So it can be given as an oral medication. It can be steroids by either oral routes or by injection, which is more specific. Then, to preserve motion and perhaps enhance motion, you can use gentle stretching exercises. And I would throw in a caution there where when I started out in taking care of swimmers, it was very common for 2 young swimmers to stand back to back or try to pull their arms around behind them, which we now know is not a very good idea. So you have to be careful and use good common sense and techniques in that too. And then lastly, you build strength, and you build endurance, and you build skill. And you start slowly and build quickly. And there are certain patterns that you want to go through. For instance, in rehabilitating a shoulder injury, you start by working on the rotator cuff, which stabilizes the shoulder. Once the rotator cuff is stronger, then you can start working on the muscles that everybody knows and that make you look good, the traps, the delts, the lats, and the pecs. Well, I treat everybody like an athlete in my practice, and I think everybody can benefit from the things we've learned from sports injuries. So it might be that we're taking care of a worker or somebody who works out. It might be a dancer, it might be a bricklayer, it might be a professional athlete. It's all the same, basically. Well, I think any time that you are unable to do the things that you need to do, such as acts of daily living, or if you can't do the things that you want to do, then you should consider consulting a sports medicine physician.
Brought to you by the Christ Hospital, 5 WLWT, and the Inquirer.